Okay, so since I'm talking about a bit about myself or my experience, so last year I published an edited book. I edited this book that I call Aging of the Oppressed. And there are 10, and it really deals with ageism and the intersectionality, about the injustice that older persons faced. And it included really researchers, including the independent expert on the rights of older persons and the previous chair of the Committee on the Rights of Persons with Disabilities. And there, so I am basing my little speech about ageism a little bit about what I have done. So the basic of the premise is that the Universal Declaration of Human Rights in 1948 really should apply to everyone, because it says very clear that we are all born free and equal, and then everyone is entitled to these rights, no matter your race, religion, sex, language, or nationality. But of course, in 1948, they didn't think that age was also an element that should be included in the declaration. In any case, if we are talking about everyone, we should be included. But however, and this is when I thought about aging of the oppressed, COVID happened. And we were naive. When I'm saying we, the advocates for the human rights of older persons, we were really shocked, like I think everyone, but we were also surprised by the extent to which ageism became apparent during COVID. Because it wasn't only that COVID-19 was killing older persons more than others, but it was also, or not also, partly they were dying more than others because the situations in which the older persons were living, because they were confined to congregate institutions in many parts without the freedom to leave or see their families, and also sometimes in institutions without appropriate protection. But also, in addition to that, so we saw the levels of discrimination, that they were not even admitted to hospitals in many places, that they were not allowed to go out. In some places, they needed to get a special permission to go out. They were also demonized by social media, being called boomer remover. Young people or people say that, oh, how great COVID is, that is helping us to get rid of people. But it was so extreme to the fact that really even the Secretary General of the UN recognized that there was a need to change that. And all the UN organizations that all published briefs and documents, they were all recognizing, and including the High Commissioner of Human Rights at the time, recognizing that there was something that needed to change, that older persons didn't have the human rights protection like all other groups. Mind you, also persons with disabilities were discriminated during that time more than others, but the sheer numbers of older people in the world is so large that really that was what it became so apparent that the levels of suffering were extreme. And this is when the idea of writing, and I thought when COVID started, I thought that I will not have much to do, that we were all confined, we were all in lockdown, and I thought, okay, this is the time to write a book. But I was little I knew that, in fact, it would be one of the busiest periods of my life because of the levels of advocacy that we needed to raise in order to show what was going on with older persons. And we, as I said, we really were naive, thought that something would change, that it didn't. But why pedagogy of the press, and I mentioned I was born in Argentina. I grew up in Latin America. So I grew up a lot with the philosophies in Latin America in the 70s. And Paulo Freire, he didn't write about older persons, but he wrote about pedagogy, and he was a philosopher and a pedagogist. And he realized that the poor people who couldn't read and write, and he wanted people to understand why they couldn't read and write, that they were discriminated, that they were isolated, that the poor people were not given the education that they probably deserved, and they didn't even know that they had the right to learn. And so he talked about in Portuguese, it's called conscientização, or conscientization, raising the awareness, becoming aware of our context and our agency. Even if to understand what our rights are, what happens to us, and in fact that we can change it. And he talked about a real dialogue and the power of the word, he mentioned that the word has two elements, the word itself, but it has always an element of action. So the word is not just the word, it's how people use the words. And this is what I was living, or what we were living through COVID, and it was so striking to me. But the real dialogue is also against the false charity and the false generosity. And this is again that I made the link that when people sometimes talk of the actions of governments or even the UN regarding older persons have been as a kind of charity. Let's look after older persons. Of course, sometimes people need to be looked after, and they need to be looked after, but we cannot only look at a group, an enormous group of people, as a recipient only of charity, of care. We also need to look into the agency of what older persons, what anybody can do, or in fact, people do. Then I also went through Augusto Boal, and you mentioned that I worked on theater, and indeed I worked on theater, and I worked on social and community theater. And Augusto Boal, who built his theory of theater based on the pedagogy of the oppressed, and he talked about the theater of the oppressed, and he wanted to create, to turn the spectator, that theater is not only to go and watch, but we need to be, and this is like a metaphor for life. Let's not just be spectators, let's just be spectators, where we take a protagonist role all the time. And also he talked about catharsis. Theater, Aristotle talks about catharsis, that brings quietness, or we take out, or we identify with the characters, and that's what in the classical theater talks. We identify with the characters, and when that we seek purity, we seek to take out everything that makes us feel bad. But he talks about catharsis as a way of disequilibrium, that we need to challenge things for action, and it is the action that brings us the purity and feeling better, and not just the identification. So then that's where I started looking for writers, and then we deal with topics like poverty, how ageism intersects, or aging intersects with other isms like and oppressions. We talked about the aging and poverty, disability, so ageism with ableism, mental issues of mental health, what happens with gender, what happens to the power of language and assumptions, that we assume too many things about older persons, about activism in old age, and the need for a human right, a life course perspective, but a life course perspective that really is a real life perspective. Too often, people talk about the life course perspective, and they mean if we deal today with the young people, then they will be okay when they are older. But no, if we don't deal or we don't work properly or adequately with the older persons of today, the young people of today will grow old to be in the same dire situation, in the same situation of operation when they grow older. So that's why a life course needs to be the whole life, and understanding that today we are, when we reach old age, we are in part a result of all the life that we have lived, but we can still learn at any time any point in time, and that the activities or the actions in order to help us should be throughout life. And of course, a human rights-based approach. And of course, I mentioned, and I talk, and the researchers talk about the need to a convention, and I will get there. So why ageism? We know that older persons are the most heterogeneous group with a diverse characteristics and abilities. So we cannot talk about a group of older people. We are not all the same. The older we get, the more different we are. When you talk about children at the age of 5, you can talk about a development, and there are a lot of similarities. But as our life course evolves, and the environment of our experiences and our health status change, so that makes us the most heterogeneous, and that's why we need a person-centered human rights approach that really takes into account the diversity, the diverse characteristics and abilities of older persons. And ageism is the stereotypes, prejudices, and discrimination based on age. Or as WHO talks in the global report on ageism, the way we think, the way we feel, and the way we act regarding older persons. And we realize that ageism is we realize the evidence shows that ageism is a main root source of the barriers that older persons face. Many of the decisions, many of the policies, many of the discrimination on older persons really are based on stereotypes and prejudice. And both negative or positive ageism are detrimental to well-being. So ageism is not only about the negative attitudes or negative prejudice. Also, the positive one is detrimental. Thinking, or the thinking that all older people are wise, or all older people are sweet, or thinking all granny, or calling me grandmother simply because I am older, or oh, how nice, all older people are nice, that doesn't help either. We know that not all people are wise, not all people are good, not all people are bad, not all people are inept. So again, we cannot put all older people into one group, and we shouldn't think about negative or over positive attitude. We need to treat people like people. So we must focus on the autonomy, in the independence, and the participation, because what happens, ageism causes to social isolation, and the lack of participation. It also creates, and the lack of our autonomy, it creates a self-ageism that older persons themselves think, oh, my time has passed, that is the time of others. And I mentioned the power of language. It is very, very damaging. Expressions or use also in science when the World Bank, for example, or many, they talk about age dependency ratio rather than maybe disability or disease dependency ratio. No, it's not just the age that will cause us to be dependent on somebody. It's the situation that we live. But to link the dependency of people and the policies simply on a number, on the age, is ageist. They talk about the silver tsunami. In fact, I also contest the silver economy. What does it mean, silver economy? It means that is an economy based on the color of my hair. It only serves the businesses who want to make money out of older people rather than the society. Or they talk about a ticking time bomb. All these expressions are used more often than you know, than you think. A ticking bomb, time bomb, defining aging as a time bomb, aging as only a negative, something that will destroy society. When the problem we know is not actually aging. Aging, we know, is a success of society. It's because our improvement of public health, improvement of our hygiene and environments, that people live longer. And suddenly we live longer in order to be blamed for living longer. The issue is not, the problem is not aging. The problem is that societies are not. They didn't prepare enough for the aging that society itself achieved. Or expressions like all dogs don't learn, or too late to learn. And we believe that it's always possible to learn. And in fact, sometimes we stop learning because we stop having the opportunities to learn. And because we don't get the opportunities, we really stop learning. But it's not because we are not able to, it's because we stop. And as I said before, old age wisdom, let's take it out. Let's take out the expressions that old age equals wisdom. Old age equals old age with the diversity that all it entails. But I mentioned aging and poverty. And really 20%, 25% of the world's older persons do not receive any social protection. And in low-income countries, and this is a picture of a favela in Brazil, in low-income countries, only 20% of older persons, in fact, receive a pension. And this is not even mentioning an adequate pension, because pensions in general are not adequate, because pensions were designed, and rightly so, initially were designed to compensate for the loss of income. They didn't take, or they don't take into account, the out-of-pocket expenses. So if you are retiring and you receive a pension that, okay, maybe enough to carry on living, but if you also need to pay for out-of-pocket for medicine or treatments that you need, or other new expenses, or the technology, or new things that appear, and you need to be updating your appliances at home, for example, the pension that you receive will never be enough. So something needs to change in order to make an adequate level of income. I mentioned the disability at the intersection of ageism with ableism, and some even call mentalism, that older persons with disabilities encounter, and they really encounter a lot of discrimination in the insertion of the labor market, for example. And they fought for it. They fought, and the they have improved a lot the situations. Not perfect, we are far from perfect, but a lot of persons with disabilities, when they are young, there is a convention on the rights of persons with disabilities, there are protection, there are programs, there is a tendency really to insertion of persons with disabilities in education and in the life. What happens when you grow old with a disability? What happens when you need to carry on receiving assistive technologies? What happens when you get a disability when you are old? Then we really, that intersection between the disability and the aging exponentially impacts the person. And like persons with disabilities fought for against the medicalization of disability, I would claim the same, that we need to fight against the medicalization of aging. Not to say that we don't need healthcare. Of course, we need healthcare, but to equal aging with disease, that is ageism. And one writer in the book, and a self-advocate with dementia, she talks about prescribed disengagement. In many cases, when somebody is diagnosed with dementia, even in early stages or with any other neurological disease or many other diseases, when you are older, doctors tell, stop working, stop doing this, stop doing that, don't go out, don't, just stay at home and disengage. That is what she calls prescribed disengagement. They tell you to stop living, basically. And I think we need to find that. This is an example that I'm also involved with the World Health Organization on assistive technologies and older persons. And the global report on assistive technology that was published in 2022 talks about that older persons have the greatest need. 2 out of 3 people age 65 need at least one assistive product. Why do sorry, it shows I raised my hand and it shows that I raised my hand. I cannot, never mind. Despite being the 2 out of 3 people that need at least one assistive product, older people are the least to receive, to access assistive products. And when I talk about assistive products, it can be a walking stick, it can be glasses, it can be hearing aids, it can be simple products to help me to hold my cup, for example. But in many places, older persons have no access to any. And gender, the issue of women, and the working group on discrimination against women in one report in 2014 said that an older woman is the litmus test for a life course of discrimination. So when an older woman, you can see in an older woman what kind of life she may have lived. And they are poorer. If I mention the fact that older people don't receive a pension, and when they receive a pension, they are more often than not adequate. If women earn less than men, or in fact work less years than men, because they are the ones who take maternity leave or stay at home to look after the children, or have to stay at home to look after older parents who may need help. When they get older, their pension will be even lower than the pension of a man. And the older women are generally the caregivers and not always will have somebody to care for them. And older women are disproportionately institutionalized, whereas older men will be looked after by their wives, if the older man, or the man in a couple dies first, which is generally the case, the woman will be hospitalized, or sorry, institutionalized in a nursing home more than an older widower. And the same issue will be for LGBTQI. Older people, gay and lesbians, are disproportionately discriminated. And when they are institutionalized, they are forced to go back into the closet because institutions don't know how to deal with, because they are not prepared, they are not flexible. So they are more at risk of abuse, neglect, and social exclusion. And that question in the bottom, has the feminist movement been ageist? And the feminist movement, and I consider myself a feminist, and we have really achieved a lot of improvements for women. But what happens when women grow older? Sometimes even the young feminists do discriminate against the older women in their groups, and it happened that with time, the feminist movement has become more focused on the younger women and not dealing enough with older women. But this doesn't have to be the case. Older people, as I said, can find agency, and older persons can be active and worry about themselves. And in the book as well, I have a chapter on the knitting nanas, knitting like they took. That is a real story in Australia. Older women who were part of an environmental group fighting against fracking and against the destruction of the environment, they realized that the younger activists were asking them only, "Granny, go and make us tea." And they said, "We don't want just to make tea. We want to be part of the movement. We want to be activists." So they took the stereotype of knitting to the extreme, and they started sitting down in roads, blocking roads, knitting, and with the messages. With time, they became a real movement and a really recognized movement, because the older women had more impact with their actions than the other activists had until then. So it became a real movement and recognized. But the same happened in Switzerland when last year a group of older women took Switzerland to court at the European Court of Human Rights against the policies for climate change, claiming that the country wasn't doing enough. And in fact, they won the case. And they are called Klimaseniornen. Now they are contesting because the government of Switzerland said that they will not respect the decision of the court. So they are appealing and they are contesting the decision again of the Swiss government. So they are active. And of course, in New York is the Grey Panthers, that this is really already for many years, they talk about we need to think about our own rights. And for many women, in fact, when they become widows, for many women, it can be really all their autonomy is taken away, because often the sons will take over. But for many women, it can also be a time of emancipation, a time of beginning to do things that they like and they couldn't do because maybe perhaps their husband didn't let them, or because when the children grow up and they are freer to do things, it's not a time to stay at home. It's in fact a time to go out and to do the things that you like. So old age can be an opportunity. And this is a cartoon from Germany that it says, "It's just I think I think that it really represents a lot of what I'm talking about. That it says, ever since Mrs. Hansen has had the caretaker robot, she has been feeling much better. But what that represents, in fact, is not the robot that is helping the older woman, is the woman is feeding the robot. So when the woman becomes active and is doing something useful, she feels much better. And I think it's a good one. It's a good cartoon. So what happens? This is the ecological framework that I use in my research on elder abuse, but I think it fits everything that we do in life. Whatever it is, every level of the ecological framework permeates and has an impact on the other. So if at the societal level there is ageism, there are discriminatory policies, and this structural abuse of older persons, it does go into the community, it has an impact on the relationship, and it has a very strong impact on the individual, and it has an impact on our health. And in fact, the report on ageism, the global report on ageism, says that people who suffer ageism has an impact on life expectancy. It shortens people's lives, even by 7 years. Living with discrimination makes us ill and makes us die earlier. So if the level of the societal level has an impact on us, then we do need to act at the societal level as well as on all the other levels. And the human rights, and I talked about human rights because human rights is not something nice that we want to be nice to people. It's about the obligations that member states, that the states, that governments have. When a government signs a human rights treaty, they commit, they have an obligation to fulfill the convention or the treaty that they have signed upon. So the states have an obligation to respect. That means that they themselves and their agents cannot violate human rights. They have to protect. So they must prevent human rights violations by others, including individuals, corporations, and other organizations and actors, including private actors, including what happens in nursing homes, for example, or other institutions. Governments have the responsibility to prevent and protect every individual, and to fulfill. It's not enough not to violate and not just to prevent. They also need to take positive action to ensure that the full enjoyment of human rights is indeed a reality of everyone. This is just a picture of the United Nations in Geneva, which is where the Human Rights Council, which is the one here on the bottom, the two pictures, the Human Rights Council meets in Geneva 3 times a year. This is where all member states, although 47 member states are part of a council, I'm not going to bore you with all the technicalities, but all governments participate at the council 3 times a year. And under 10 items, a lot of issues are discussed, whether there are individual country situations or technical or thematic areas, like the rights of women, like the rights of persons with disabilities, like the rights of older persons. And here is where a picture of a graph of the international human rights mechanisms. So I mentioned the treaty bodies. The treaty bodies are the conventions that the governments sign onto, and they become an obligation, mostly for those who ratify, but actually many can also report on how they feel, even if they have not signed. The impact that a convention has is very powerful. So at the moment, there are 9 and 10 international conventions that most governments have signed. No, some have signed many. I mean, the Convention of the Rights of the Child have been more universally ratified than others, like the migrant workers have not many have ratified in comparison, but they fulfill what happens when they sign, when they draft the convention, they sign it, then the ratification means that the parliament of a country has to ratify the convention, then it becomes national obligation. It's not enough to sign it at the UN, they have to ratify by the parliament. And then when there is a minimum number of ratifications, then a committee is established, and in that committee is a committee of experts that their role is to examine, to monitor how the convention is implemented. And that every country, every 4 to 5 years, has to report to that committee, and questions are asked and recommendations are issued to the country, or can be congratulated as well or commended for improvements, but they can also be given recommendations on how to improve in the future. So you can see here is the Committee on Economic, Social and Cultural Rights, the Committee on Elimination of Discrimination Against Women, the Committee on the Rights of Persons with Disabilities, and the Economic, Social and Cultural Rights, and the Committee on Civil and Political Rights. Those two are the covenants, and they were the first ones that were created after the Universal Declaration of Human Rights. But again, they are very general, and they should again cover everybody. But again, after the implementation, people realize, or governments and people realize, that there were not enough detail to cover all the discrimination, for example, that women suffer. And there were specific issues that children encounter that were not covered under the covenants, not enough. And that's why these conventions were created. And as you can see, what we don't have, we have a convention against discrimination of the child, we have against discrimination of women, we have persons with disabilities. We don't have one convention to protect the rights of older persons. And this is what we're trying to work on. Then in the middle, you see the Human Rights Council that I showed you the picture of. And under the Human Rights Council, and that, as I said, they meet 3 times a year with a very busy agenda, but also reporting to the Human Rights Council. It is another mechanism that is called the Universal Periodic Review. And there, every country, there is no need to ratification at all here. Every country, every 4 to 5 years, reports to the Universal Periodic Review, has to issue a report, and is examined by peers, not by a group of experts, by also peer governments. So it's for every session there is a troika. 3 member states are in charge of writing the report and bringing together the recommendations that any other government can provide. Member states, governments like this process because they feel less threatened when there is a peer review. So everybody participates in this one. They are not always happy when experts examine and give recommendations. The Universal Periodic Review it has been quite successful but of course, because it's very general, we find that older persons are very rarely included, because of being general and there are so many, they call it important issues, we older persons are seen as less important. We have tried, and we are actually changing the situation since there are resolutions on the rights of older persons. There are more questions being asked to member states about older persons. If they report, they are commended on that or giving recommendations. And if they haven't reported, a question will be posed to the government, what do you do about older persons? And then, apart from the UPR, there is also the special procedures. Special procedures are the special rapporteurs, independent experts, and working groups that deal with specific topics, like the working group on women and discrimination against women and girls, or a working group on business and human rights. And then there are also thematic special rapporteurs, like the special rapporteur on violence against women, or the special rapporteur on persons with disabilities, or the special rapporteur to the right of health. And there are also special rapporteurs or working groups that deal with specific country situations. There will be a special rapporteur on the situation of Ethiopia, for example, or they can be created according to specific situations of conflict that may arise. So there are country-specific mandates and there are thematic mandates, and within the special procedures, we have the independent expert on the human rights of older persons. And then we have as well other international conventions that are outside of the international human rights system. And that will, for example, the ILO has conventions on labor standards, which are interesting because they are a tripartite system, that they are, although they deal a lot with human rights into their conventions, but it is outside of the UN human rights system. And WHO, they have a framework convention for tobacco control, against tobacco, that was adopted in 2000, in the early 2000s. And now WHO is working on a framework convention against pandemics, or to prevent pandemics, which proves to be very challenging, but that would be the second convention that WHO will adopt. And then you have regional mechanisms. There are inter-American conventions, there is an Inter-American Convention on the Rights of Older Persons that was adopted in 2015. There is also an African protocol on the Charter of Human Rights of African peoples. And in fact, it came into effect early November, when the minimum number of, I think, 15 countries, and Nigeria was the 15th country to ratify, and the protocol came into effect only recently. But really, a regional mechanism, although extremely important, it doesn't cover everyone. And in fact, your region is not covered by them, and there is no convention on rights in Asia, for example. In Europe, there are several, but there is there are specific recommendations on the Council of Europe as well. There are recommendations on long-term care, there are recommendations on many topics, but it's nothing that is binding, because the force of a treaty body, of a convention, is that it's legally binding. As I said, it's an obligation. Recommendations are such that, recommendations. Oops, sorry. So what are the challenges for a greater protection of the rights of older persons? We said we have no agreed international standards, because that's what the convention does, creates standards, or not necessarily creates them, but puts them down in an organized manner. we don't have enough disaggregated data. Many times they say we don't have the evidence to show. We don't have the evidence, but we also don't gather the evidence. And sometimes a lot of information is gathered and we put older persons in one box, 60 and above. And of course, we mentioned about the heterogeneity of older persons, and really being 60 is not the same as being 80. Maybe in some cases, yes, but when you collect data and putting everybody 60 and above, it doesn't show you what the real picture is for perhaps somebody at age 95. So what we need is disaggregated data by age bands, maybe every 5 years. Some will say 10 years. I would claim that we need every disaggregated by every 5 tranche of year ages, and also that is diverse regionally, and data that represents the real situation because a lot of the information that we have when we talk about elder abuse, for example, the majority of the information, the vast majority of the information comes from Europe and North America. We don't have enough evidence, we don't have enough data from the South. And we know that there is little and uneven coverage by existing new age human rights mechanisms. I mentioned we don't have any, apart from we have an independent expert, and I will come back to that. And there is a disconnect between non-binding instruments. It's not that we have nothing on aging, we have a lot. And really in your part of the world where there is a lot of activity and there is a lot of action towards on older persons, but they are not necessarily human rights based. And there is a disconnect between the Madrid International Plan of Action, for example, on national policies and the human rights mechanisms. And even if member states or governments have ratified a convention on the elimination of the rights of women, elimination of discrimination against women, they will not automatically think about older women as being part of it. And so there is a disconnect between the policies and the human rights mechanisms. And now I want to go into what happened, a little history, and I'm still okay with the time. In New York, we have two processes. In New York, we had really already in 2010, there was an admission that there was the need to protect better the rights of older persons. And the General Assembly in New York established a working group, an open-ended working group on aging to analyze how the existing human rights protect or not the rights of older persons, and to check the feasibility of an instrument. And the first session was established in 2011. But then we had 14 sessions, and there was a lockdown, a locked situation where government saying we need a convention and government saying we don't need a convention. In 2012, there was another resolution that was not adopted by consensus. The UN always strives to achieve consensus. That means that not a vote, that to reach a language that everybody can agree upon. In 2012, there was a resolution saying that the working group should be working on elements of a convention, but it was approved by the General Assembly, but many governments were not in favor, and then they were not inclined to implement it. And the working group carried on working without making any decisions. I can tell you that more than 1,000 documents were presented, an enormous number of presentations were done during the open-ended working group, and there was no movement forward. There was no decision where to go. It was clear that there was a need to improve, but there was no decision of what that way was. Many governments still today claim that the problem, we don't need another convention, that we need to better implement the existing mechanisms. As I said, in theory, they should all cover all of us, but in practice, they don't. They don't. And member states, the governments don't report on older persons. They are not always asked questions of an older persons. We don't have a place where to go and complain. So there was a change in 2023 where there was a process of consultations to really try to reach a decision that is negotiated among governments. And in 2024 really was the first decision with meat, if I may call it like that. That it was this year, in May, between 2023, there was a decision to establish a consultation to discuss whether there are gaps in the human rights framework. During that year, there were consultations and webinars and questionnaires, and governments negotiated what came out of all that evidence that included also the 14 years of evidence gathered in the open-ended working group. They couldn't reach one decision. In fact, they made a decision, but their decision included a list of recommendations. What does it mean? They didn't say we really need a convention. It says we need a convention as one of the recommendations. They say we need a convention, but we also need to implement better, which is fine. It said that all the list of recommendations is in a non-exclusive manner, that we need a legally binding instrument, that we need to better implement, that we need all the UN, the relevant organizations need to really relate and improve how their actions relate to older persons, to the rights of older persons. So that was the best that they could get, but really includes the need for a legally binding instrument. And only 3 months later, this was in May, in August, a General Assembly resolution adopted that decision issued by the open-ended working group and takes the list of recommendations as part of a General Assembly resolution, and that was adopted by consensus. And that resolution also said the open-ended working group fulfilled its mandate and ceases to exist. So the open-ended working group last session was last May 2024. So you may say, oh, that's bad, we will not discuss. I don't think that's bad. I think it's good, because 14 years of discussion, yes or no, or not moving forward on something that can really be effective, wasn't taking us anywhere. And that, the fact that there is a list of recommendations that includes the need for a legally binding instrument and calls for the relevant UN agencies or UN programs to move forward into applying or into improving the rights of older persons, opens the way for the, this is a picture of me during the 2011, during COVID, that we couldn't attend, that we were not allowed to attend in person, but also showed how empty the room was. Even during COVID, when we needed the attention of governments, governments didn't think it was important enough to attend the open-ended working group. Okay? And there were, at times, there was not enough quorum. There were not enough governments in the room to carry on the discussion. But back to what I was saying, that was for me a totally a turning point, saying the open-ended working group, when there's not enough interest and the discussion doesn't move forward, needs to end in order to open the way, to open the window or the door for the Human Rights Council in Geneva to deal with what they are mandated, with human rights. And in Geneva, in 2 years, there was more advanced than 14 years in practical terms. In 2013, there was establishment of the mandate of the independent expert, who makes 2 visits a year to countries, and we have the reports. And also they has a year thematic report on specific topics. One was on older persons in emergencies, or on older persons in violence, abuse, and neglect. Or on 2021, she wrote a report on ageism and age-based discrimination. And governments were not in favor of open a specific group on the rights of older persons, because they didn't want to duplicate the efforts of what was going on in New York. But at least they said we need to increase the language that is agreed language, that all member states agree. And in 2021, taking as a basis the report of the independent expert, was the first substantive resolution. That means governments negotiated a resolution, and ageism became part of the official language of human rights. Ageism and age discrimination became part of the human rights language. And in and that resolution also called for several actions. A report on the normative standards and obligations and the international human rights law, and a multi-stakeholder meeting with all stakeholders to discuss that report. That happened in 22. And then there was another resolution in 23 on violence, abuse, and neglect, based on the report by the independent expert, that also called for an expert meeting on legal obligations. Legal obligations, we increase the status, we increase the language on human rights. It's not just about we need to fight elder abuse. What are the obligations of member states in order to prevent and to fight elder abuse? And there was that expert meeting in last June. And now we are discussing and hope there is a decision of the core group, of the group of governments who do the resolutions, now that the open-ended working group in New York is closed and that the General Assembly includes the need for a legally binding instrument. Now is the moment for the Human Rights Council to hopefully establish a working group that will be in charge of developing a convention, a legally binding instrument. It will not happen overnight, but we do hope that in the upcoming session in March, the Human Rights Council will adopt a resolution, and then that they will start talking specifically what is the scope, what is the language, what are the topics, and how we can draft a text that then has to be agreed upon and signed and ratified, so it can become a legal obligation. So all the reports that I mentioned at the Council, they all say that the existing human rights framework provides fragmented and inconsistent coverage, that the existing mechanisms have not been systematic, coherent, or sustained, and that the lack of dedicated legally binding instrument and the limitations of the existing instrument continue to hinder the effective protection of the human rights of older persons. And all the reports and all the expert meetings say that the states should, in collaboration with civil society, national human rights institutions, the UN, and older persons themselves, develop and adopt a comprehensive convention on the human rights of older persons. And one of the advantages for us, for civil society, of starting a working group in Geneva at the Human Rights Council is that at the Council, civil society has a voice, has a place in the room. We participate in the negotiations. We can raise our hand when they negotiate a text of a resolution. We can send proposals for language. That does not happen in New York. And even the last decision, it was only if you had a friend in a delegation, in a mission to the UN, that they will listen to you and ask you what you think. But here at the council, at the council, civil society can attend, is part of the process. Effectively, it is the member state, it is the governments who will negotiate and adopt an instrument. But the consultation, it's open, it's all transparent, and so it should be. A convention, as I said, will codify, will put black and white, what are the standards and the norms, what are the obligations for the governments to fulfill. Also, it's not just about making obligations, it's not about criticizing governments, it's about guiding governments in how to adopt laws that are not discriminatory, because sometimes it's not on purpose, sometimes it's because they don't know, ignorant, or because simply they didn't think about it. But a convention can assist governments in how to implement, how to enact laws that are friendly, that are in line with human rights, but also oblige them to comply and work to eliminate ageism. Because until now, even people talk about combating ageism. In human rights, you talk about eliminating ageism. That is what you need to strive towards, to eliminate ageism and the discrimination. Then also, we'll draw attention to the multiple and intersected discriminations. As I mentioned, the intersection, what happens with an older woman, what happens with an older person with a disability, etc., or what happens with poverty in old age, and provide a basis for advocacy and public awareness. This is, we know from experience, from the moment there is the Convention on the Rights of Persons with Disability, the number of budgets going on, implementation of programs on disability exponentially grew. And that helps civil society to have advocacy and to raise the public awareness. It's not just what I think, it's all governments think that older persons have rights. It's not about separating older persons. It's not about necessarily talking about different rights. It's about how to implement the universal human rights in older age. It's about providing a place where we can complain. And it's also about talking about issues that they didn't think about when talking about other conventions like long-term care or palliative care. They are not part of other conventions. Provide a reporting and accountability mechanism, and that is what the committees do. And that's when they have to, member states have to report, and it's accountability. And we can do a lot. We are doing quite a lot, but we can do much more. But again, as I said, we do have a place. We can interact with the existing mechanism. We can submit in Geneva, either to all the treaty bodies, but also particular to the Human Rights Council. We can submit written statements. We can deliver oral statements. We can quote the relevant resolutions in all the documents that we produce. We can bring the human rights into anything that we do. We can lobby our governments into including older persons in the reports and in resolutions. By participating in the negotiations, it really enables us to also approach individual governments, but also in the capital of our country. We should be able to look how our government speaks about us at the international fora. We should interact, everybody, with the independent expert during especially when she visits our countries, but also with other special procedures. If the special rapporteur on violence against women, for example, visits the country, we should meet with her as well and ensure that all the women are invited to the meetings with civil society, because generally they don't think about it. And I think I will leave it here. And I will thank you, and I'm very happy to open it for discussion. And I don't know if you want to share, I put a few list of I thought that might be interesting reading for everybody.